Hello friends, and welcome back to our channel. We're going to be discussing a very important subject today, symptoms of skin cancer. We'll look at the key markers today that can help you catch skin cancer early and possibly save your life. Always remember that effective therapy depends on early discovery. Now let's get started. What are the common warning indicators of skin cancer then? The following are important signs to look out for. Number 1. New growths, any recently developed skin growths that don't appear to go away. Number 2, modifications to current moles. Seek to identify any alterations in mole size, shape, or color. Number 3, non-healing sores. These are wounds that either never heal or heal but then recur. Number 4, itchy or painful spots, tender, hurting, or itchy areas on the body. Number 5, unusual lumps or bumps, any lump or bump that isn't normal, particularly if it's firm. Melanoma, squamous cell carcinoma, and basal cell carcinoma are the 3 primary forms of skin cancer. The most prevalent types of cancer are squamous and basal cell carcinomas, which often progress slowly. Melanoma is less common, but more aggressive. Although each variety has distinct traits and risk factors, all have the potential to be dangerous if not caught in time. Melanoma signs and symptoms. Melanoma can develop anywhere on your body, in otherwise normal skin, or in an existing mole that becomes cancerous. Men who are impacted by melanoma typically have it on their faces or trunks. In women, this type of cancer most often develops on the lower legs. Melanoma can develop on skin that has not been exposed to the sun in both men and women. People with any skin tone can be affected by melanoma. Melanoma typically appears on the palms, soles, or under the fingernails or toenails of individuals with darker skin tones. Melanoma signs include a large brownish spot with darker speckles, a mole that changes in color, size, or feel, or that bleeds, a small lesion with an irregular border, and portions that appear red, pink, white, blue, or blue-black, a painful lesion that itches or burns, dark lesions on your palms, soles, fingertips, or toes, or on mucous membranes lining your mouth, nose, vagina, or anus. A word of caution. Remember, this video is for informational purposes only. If you have concerns, talk to your doctor. They can advise you on the best screening methods for your individual situation, especially if you have any underlying health conditions or are on medication. If you like what you've seen thus far, please click the like and subscribe buttons and the bell notification. Thank you for viewing. The worst type of skin cancer is melanoma. However, it may often be detected by applying the ABCDE rule. Number 1, asymmetry, when 2 halves are not equal. Number 2, B for border. The edges are jagged, sloppy, or unclear. Number 3, C for color. This color isn't uniform throughout. It can have hints of pink, red, white, or blue, in addition to various tones of brown or black. Number 4, D for diameter. Although melanomas can occasionally be smaller, the spot is greater than 6 millimeters across or around the size of a pencil eraser. Number 5, E for evolving. The color, shape, or size of the mole is changing. Let's take a closer look at each of these with illustrations for your understanding. Signs of skin cancers other than melanoma. Compared to melanoma, basal and squamous cell carcinomas are less lethal, but still very dangerous. Observe the following. Cancer of the basal cell. Sore that bleeds or scabbing that heals and recurs. Pearly or waxy bump. Flat, flesh-colored or brown scar-like lesion. Squamous cell carcinoma. Sore that heals and recurs. Firm red nodule. Flat lesion with a scaly crusted surface. Signs and symptoms of less common skin cancers. Other, less common types of skin cancer include sarcoma kaposi. This uncommon type of skin cancer appears as red or purple spots on the skin or mucous membranes and starts in the skin's blood vessels. People with compromised immune systems, such as those with AIDS, and those on drugs that impair their natural immunity, like those who have received organ transplants, are at higher risk of developing Kaposi sarcoma. Older males of Italian or Eastern European Jewish descent and young men residing in Africa are also at higher risk of developing Kaposi sarcoma. Cancer with Merkel cell carcinoma. Merkel cell carcinoma causes firm, shiny nodules that occur on or just beneath the skin and in hair follicles. The head, neck, and trunk are the most common locations for Merkel cell cancer. Cancer of the sebaceous glands. The skin's oil glands are the source of this rare and severe cancer. Sebaceous gland carcinomas can form anywhere, but they most commonly occur on the eyelid, where they are commonly misdiagnosed as other eyelid issues. Typically, they appear as hard, painless nodules. It's critical to visit a doctor as soon as possible if you have any of these symptoms or indicators. Your chances of a cure can be greatly increased by early detection and treatment. Who is in danger? Well, a few things can raise your risk of developing skin cancer, such as: Number 1, overexposure to sunlight, UV rays from the sun or tanning beds. Number 2, fair skin. Lower melanin levels result in decreased UV protection. Number 3, family history. There may be a genetic component. Number 4, skin cancer history. Having skin cancer once raises your risk of developing it again. Number 5, immune system suppression. Immune system weakened as a result of diseases or therapies. It's important to prevent. Here are some pointers. Use sunscreen with a minimum SPF of 30 and stay away from tanning beds. Don sunglasses, caps, and protective gear. When the sun is at its strongest, 10 a.m., 4 p.m., stay in the shade. Conduct yearly visits to a dermatologist and self-examine frequently. Regular self-assessments are essential. Here's a detailed how-to. Number 1, face and scalp. Examine your scalp using a hairdryer and a mirror. Number 2, hands and arms. Examine your hands from palm to fingertip, under your nails, and in between. Next, examine your upper arms, elbows, and forearms. Number 3, torso. Examine your torso, chest, and neck. Women ought to look behind their breasts as well. Number 4, back. Examine your neck, shoulders, upper back, and lower back using a hand mirror. Number 5, legs and feet. Take a seat and examine your feet, between your toes, beneath your toenails, and the front and back of your legs. Number 6, genitals. Remember to examine the area around the genitalia. Skin cancer is a dangerous but curable illness. You can greatly lower your risk by being aware of the warning signs and symptoms and by taking preventative action. Recall that this is not a diagnosis, rather these are guidelines. See a dermatologist right away if your skin seems to be changing in any way. Your best lines of defense against skin cancer are sun protection and routine skin examinations. Remember, this video is for informational purposes only and should not replace professional medical advice. If you're experiencing any of these symptoms, consult with your healthcare provider. If you found this video helpful, give it a thumbs up, share it with someone who might benefit, and comment down below with any questions or topics you'd like us to cover in the future. Thanks for tuning in, and I'll see you in the next video.